talk will be a keynote address by Dr. Mukesh Kumar KHARE on informed consent.
My dear chairpersons and 1, 2, 3, 4, 5, 6, 7 delegates. I'm still happy. Consent is a major source of dispute between doctor and patient, not only in India, but all over the world. Informed consent and real consent are two schools of thought. In our country, Supreme Court has preferred real consent over informed consent. It is a process of communication between patient and doctor regarding the authorization of patient for the proposed treatment. But it is very important to remember that it is not only a signature on a piece of paper. It is legal and ethical thing to do. In a very interesting case, a patient alleged in court that I have operated him for cataract, though he had no cataract, and just to extract money, I have operated him. Just because of a proper consent, I could easily win the case. It saved doctor in law of court. Why patient need it? Because every person has the right to determine what shall be done with his or her body. In a very interesting case, Samira Kohli versus Prabha Manchanda, Supreme Court held unauthorized invasion, I repeat, unauthorized invasion and interference with patient's body amounts to negligence. An unmarried woman, PV bleeding, had fibroid chocolate cyst of ovary. A consent was taken for laparoscopy and laparotomy may be needed. On the table, the treating surgeon had to take a decision regarding doing hysterectomy. Her assistant took consent from the patient's mother. Now the patient alleged hysterectomy has been done without her consent. Now how the Supreme Court dealt the case? Can the doctor be held negligent in taking decision of hysterectomy on table? Court said no, on the ground that expert witness and textbook references favored the line of treatment taken by the treating surgeon. The second question was before the court, is the doctor still liable? Court said yes, doing hysterectomy without proper consent is negligence. Hence, it is very important that we should not trespass the limits of consent. In the same case, court held, even in England, there is a tendency to make the doctor's duty to disclose more stringent. And 2008, the Supreme Court predicted that England may adopt the version of informed consent. And it happened in 2015. In the same case, Supreme Court held, and I quote, "We have, however, preferred real consent concept over informed consent." In an interesting case, in 2009, a patient was operated for cataract without improvement in vision, and a consent was taken by grandson. The court held doctor negligent on the ground that adult competent patient, hence there is no question of someone else giving consent on his behalf. One more interesting case in 2009 on same doctrine, the consent has shifted from doctor knows best attitude to a more shared decision making. Again, a landmark case, 7 judges bench of UK Supreme Court. A short statured diabetic patient gave birth to a baby. A baby developed shoulder dystocia, causing severe brain injury due to hypoxia. The patient alleged if she would have been warned regarding the shoulder dystocia, she would have gone for cesarean section. Now, how court dealt that case? Court held, Supreme Court, the patient has her own right to make her own decision based upon sufficient information, and reiterated times have moved on from the doctor knows best. The court ruled that unequivocal position was that she would have chosen to give birth by cesarean section, and the patient won £5 million. This judgment outlines the rule on the disclosure of risk to satisfy the criteria of informed consent, where patients should be made aware of every possible complication. Every possible complication. On the basis of these judgments, competence, disclosure, understanding, voluntariness, consent, and approximate treatment costs are the ingredients of real consent. Now, how much to be disclosed to the patient going for surgery? All the risks potentially affecting the decision making of the patient must be unmasked. It is a legal duty. It should not be delegated. Either doctor or his assistant should take the consent. Very often, our prescription, if signed by patient, become the part of consent and patient information sheet. This is the consent form which I use. It is important to highlight the major issues on the consent, and doctor should also sign the consent. One more, where the highlight of the issues with that patient has been highlighted. A surgical consent cannot be sufficient for the general anesthesia. Now, how can we improve the consent? We can spend some quality time with patient and family, and to verify the patient understanding, ask the patient to write in his own words what risks are. In informed consent, doctor is required to disclose all information to the patient, while in real consent, it is for doctor to decide how much to disclose. We should try to achieve a near perfect consent from the patient, which cannot be disputed in the law of court. However, no consent absolves the doctor of his duties toward his patient, nor it gives immunity against the professional negligence. Thank you.
Thank you, sir. That was a very informative talk on informed consent.